Good morning.
Morning.
Okay, my name is John Gitonga Militi. I'm a clinical officer at Bokore Health Center, and I'm the focal person about possible severe bacterial infection. I want to take you through tools which are used for assessment of children who are under 2 years about possible severe bacterial infection when you are managing them. Welcome.
Where referral is not feasible, 0 to 59 days. Check of danger signs. Where we talk of fast breathing, that is respiratory rate of more than 60 per minute, severe chest indrawing, fever of more than 37 degrees, hypothermia or low body temperature of less than 35.5 degrees, no movement or movement only on stimulation, feeding poorly or not feeding at all, and convulsion. Sick young infant, 7 to 59 days, with only fast breathing should be treated at outpatient level with oral amoxicillin dispersible tablet daily for 7 days and a mandatory review of newborn on day 4. 0 to 59 days with PSBI signs assessed by a trained healthcare provider should be referred to the hospital. Where referral is accepted, support and facilitate referral. Where referral is not accepted, accessible, affordable, or families cannot access a referral facility, then reclassify as follows. 0 to 6 days, only fast breathing, treat as pneumonia, and give oral amoxicillin tablets daily for 7 days. Mandatory review of newborn on day 4. Where sick young infants have the following: severe chest indrawing, fever of more than 38 degrees, hypothermia temperature below 35.5 degrees, feeding poorly or not feeding at all on observation, movement only when stimulated, classify as severe pneumonia or severe infection, and treatment is gentamicin injections once daily for 2 days and oral amoxicillin twice daily for 7 days. Reassess every injection visit and mandatory follow-up on day 4 and day 8. Those sick young infants who have convulsion, unable to feed at all, no movement even on stimulation, unable to cry, cyanosis and bulging fontanelle are classified as critical illness, and referral is emphasized here. So continue to reinforce referral to the hospital, but it's advisable to give a pre-referral treatment. And in our setup, we're talking about benzyl penicillin and gentamicin injection.
So let's say a baby comes after 2 days for review, and then the symptoms like the fevers, the inability to breastfeed, the baby has improved. Can we reclassify like the way we do in dehydration?
I need to respond to the question. First of all, you are asked about reclassification. Yes, always we need to reassess. The child has been put on gentamicin for 2 days or amoxicillin for 7 days to be assessed day 2, day 4, and day 7, isn't it? Therefore, when this child comes, you must be able to assess the signs and symptoms. For example, the child presents the severe lower chest wall indrawing. You need to reassess. Is this child still having the same, or is it getting worse? Okay, you need to reclassify again. But remember, conditions like pneumonia, they are not so progressive that you move from severe to pneumonia and then no pneumonia. Okay, you can move straight away after you have been treated from severe pneumonia into resolving pneumonia. No pneumonia, isn't it? It's not something very progressive.
There are other ways of also ensuring now the parent will be willing to come back at these review days, 2nd day, 4th day, and the 8th day. In the first place, you ensure before you start the treatment, you consult the parent about the all treatment costs should be required to come for review in these prospective days and the importance of coming back. This will also help the mother to willingly come back for review. So counseling is important.
You know very well that in the community there is the community strategy. You ensure that you locate the locality of that grant, then you refer to the nearest community health volunteers, and you write a referral letter like this one. And if you are able to get the telephone number of that community health worker, you call so that you link this kid to that community health worker. Yeah. For the purpose of follow-up in that community. Now let us come to assessment and follow-up of young infants who are less than 59 days in a situation where that you are unable to refer that child to the next level for purpose of admission. Now this is the tool which is used for that purpose. Now, as we continue with the referral forms, this is the next form, referral form, which is used for the purpose of referring the young infants to the next facility, either to a specialist or for the purpose of admission. I have noted with concern the importance of linkage with other institutions or other stakeholders who are concerned about infants who have possible severe bacterial infection. For example, clients who come away from our catchment area, it is important to have a way of linking them to other community units away from our place or any other stakeholder who is interested with the care of young infants.